Embodied result sheet outputs. From this lecture, we are going to learn how does each InBody outputs can be interpreted. This is the result sheet of InBody 770. As InBody 770 contains the biggest information, let me explain this result sheet from the top to bottom. The first part is the body composition analysis. This part is showing quantity of each body composition value, and you can see categorization of each body compositions. Basically, InBody is showing total body water, protein, mineral, and fat mass. Total body water comprises half of the body mass. Therefore, it is essential to keep total body water as normal value to stay healthy. Protein is the composition of muscle. Lack of protein may indicate malnutrition. Minerals also require to be monitored, as decrease in minerals may lead to osteoporosis. Lastly, excess of fat mass may lead to obesity. However, it is also essential body composition to stay healthy. Total body water and protein comprises soft lean mass, which is indicating muscle. And if you add on mineral mass to the soft lean mass, that it indicates fat-free mass. This can be an indication of nutritional status. Lastly, if you add on fat mass, then it comprises your body weight. Muscle fat analysis shows body balance just at a glance. Each graphs of weight, skeletal muscle mass, and body fat mass are adjusted to have similar length of the graph when the body is well balanced. Therefore, you can analyze body balance by comparing the length of each graph. Connect the end of these graphs, and this is the shape for the person who has low muscle mass. This is indicating that the person may proceed to sarcopenic obese or skinny fat. If this person works out and develops more muscle mass, the graph will show more balanced muscle fat graph. If this person increases more muscle mass, you can see the graph of muscular body. InBody is showing the visceral fat area by setting an algorithm. The algorithm was set by the result of CT scan and impedance value of the InBody. Visceral fat is located in between internal organs and torso. The white part of CT scan is indicating visceral fat. You can see that the scan of right side has significantly more visceral fat area as he has type 2 diabetes. 100 square centimeters of visceral fat area is considered as a standard value. However, normal range for visceral fat area is different to different age group. The shade is indicating the normal range for each age group. If you are 20 years old, your normal range is in between about 10 to 100, and if you are 60 years old, then your normal range is in between 50 to 150. With the obesity analysis, we can determine obesity according to BMI and percent body fat. BMI is calculated by weight divided by height square meter. BMI index is indicator of the body volume. It can only indicate outside appearance of our body. On the other hand, percent body fat is showing ratio of fat mass. This is indicating obesity according to body composition. This person has a normal BMI, which is indicating that he has normal body size. However, his percent body fat is over the normal range. This is indicating that he might seem normal from the outside appearance. However, his body composition is absolutely indicating obese. This person needs to increase more muscle in order to avoid sarcopenic obese. This person's BMI is over the normal range, which is indicating that he is tall and big. If we just look at his BMI, he might be misunderstood as obese. However, check that his percent body fat is in the normal range, showing that he has enough muscle mass. Likewise, body composition is telling you what actual health status according to body composition. Segmental analysis output shows you which part of your body is well developed and which part of your body needs more exercise. And this output consists of two different graphs for each segment. The top graph shows an actual amount of lean mass for each segment, and its normal range is determined based on the subject's height. The bottom graph shows percentage of segmental lean mass, which is compared with the current weight of the subject. Therefore, it is indicating adequacy of segmental lean mass. This person's right arm graph is over the 100%. This is indicating that his right arm lean mass is enough based on his height. On the other hand, the bottom graph is lower than the 100%. This is indicating that his right arm lean mass was not enough based on his current weight. His muscle mass is enough if he had normal body weight. However, as he is overweight, he needs more muscle to support his body. This person seems to have low lean mass as her top graph is lower than 100%. However, if you look her bottom graph, it is slightly over the 100%, which is indicating that her lean mass is enough according to her current weight. Likewise, you can evaluate person's muscle development by comparing the top graph and the bottom graph. Extracellular water analysis is showing whole body extracellular water ratio. It is ECW volume compared to total body water volume. As InBody is using multi-frequencies, it is capable of assessing intra and extracellular water separately. Normal healthy people keep their extracellular water volume about 38% among total body water. However, when human body has abnormal body condition, they lose to control water balance and extracellular water volume tend to increase. Therefore, monitoring ECW ratio periodically is important. Also, InBody shows the ECW ratio at segmenter, because in case of dialysis or surgical patient, monitoring ECW ratio by segmenter can be an important diagnostic factor. Weight control shows your recommended body weight and how much of muscle and fat you have to control to reach that recommended weight. The plus means to gain and the minus means to lose. Target weight is determined based on BMI and body compositions. Here is a woman who has BMI under 21. She has very low fat-free mass and even low fat mass. For this kind of person, InBody recommend to increase both muscle and fat. Here is another woman who has skinny body but her BMI is just over 21. For this woman, InBody recommended her to increase muscle mass but not fat. We let her control her body composition as long as her body weight does not go too low. Then let's have a look totally different case. For obese person, InBody recommend them to reduce fat mass, and these kinds of people normally have high fat-free mass as well. However, keeping those fat-free mass high is a good sign, and InBody does not recommend them to lose their muscle mass, even though they have overweight. On the other hand, if the person has high body weight with low fat mass, InBody does not recommend them to do any weight control. Additional data output are providing various research parameters for medical purpose. Basal metabolic rate is the rate of energy expenditure at rest. Therefore, if you keep BMR high, you get to use more energy even at your resting status. InBody obtain BMR based on Cunningham equation. As this Cunningham equation uses fat-free mass to obtain BMR, the BMR increase or decrease according to fat-free mass change. Body cell mass is total sum of intracellular water and protein. This is indicating all the cellular elements in human body which constitute metabolically active tissue. This body cell mass is useful when assessing edema patients. Because lean mass is including ECW, edema patients would have increased lean mass as they have increased ECW. However, because BCM only include intracellular water and protein, it is not very much affected by edema. Phase angle indicates cell membrane status. Many of medical doctors have used this parameter to diagnose the health status of patients. Especially, it can be used for palliative cancer patients. Lastly, checking impedance is very important. All the body composition analysis is done based on this impedance value. Providing segmental impedance value by each frequency is a unique feature of the InBody. Impedance value can be also used for research purpose.